Hello, everyone. I'm Jabji. Welcome back to the next episode of Aditya Birla Health Insurance's Health from Home series. Today's episode is a special one because we're going to talk about an issue that is on everyone's mind these days: breathing and oxygenation. That is, how to improve our breathing and oxygen levels. While there's a lot of information being circulated on the topic, no one seems to have clarity or solution to it. I'm sure you would have a lot of questions and doubts on your minds too. That is why, to answer all those questions and give you a better understanding of oxygenation and breathing techniques, today we have with us Dr. Amee Shah. She's a highly qualified cardiopulmonary physiotherapist who has more than 10 years of experience in dealing with patients with cardiovascular and respiratory problems. A very warm welcome to you, Dr. Amee.
Hi, and thank you for the warm welcome.
Thank you, Doctor. Doctor, you've been dealing with patients with respiratory problems both before COVID and also in the current times. Are there any differences in the patterns that you've noticed in terms of how COVID affects our breathing differently?
So we all know that COVID-19 is a deadly virus, and it has an affection for our respiratory system. Now, when I say respiratory system, it means our lungs. Okay, and when we talk about lungs, lung is an organ which is made up of airways that start from the nose. That's when you breathe it, and that these airways lead the air or the oxygen to small sacs, air sacs that are called as alveoli. Okay, so during the normal breathing process, we breathe in air from the nose. That air, the oxygen from that air gets filtered by the alveoli, gets mixed with the bloodstream, and that's how oxygen is circulated in the body. There is another function of the lung is the carbon dioxide, that is the waste air that is created, has to be expelled by the lungs. So that is what happens during the normal lung functioning. With COVID, these alveoli, the tiny air sacs, are the ones that are getting infected. So there is an issue of oxygen getting filtered and circulated in the blood, and which is why patients are facing with problems like not getting enough breath, not getting complete oxygen, and they are feeling breathless or short of breath while doing some activity. So these are the common problems that we are seeing in patients post COVID. And also, there are patients who have residual cough. So, whatever infection or the residual waste that is left in the lungs and not cleared is tends to thicken the mucus, that is the sputum inside the lungs. And again, coughing is another problem that we are seeing in post-COVID patients.
Okay, that's interesting. What are the effective breathing techniques that one should follow according to you to combat this?
Okay, so when I say breathing techniques, now breathing techniques are basically strategies to help you breathe better. Okay, now what happens is I would not restrict this to only COVID patients, but there are a lot of long-term there are a lot of patients who have long-term pulmonary illness, means long-term lung issues like long-standing asthma, or they've had tuberculosis, and post tuberculosis their lungs have been restricted, or they have lung fibrosis, ILD, idiopathic lung fibrosis, which is different from the COVID fibrosis. And they all tend to have problems. So what happens is, in these patients, also in the COVID patients, the normal pattern of breathing gets disrupted because of the illness. So the normal muscles of breathing, okay, the muscles around the chest, the diaphragm muscle, which is a large flap like muscle which does 80% of the breathing, they tend to get either weakened over a period of time, or they are not functioning as well. So with these breathing techniques, we try and retrain these ventilatory muscles, and that is how we achieve better lung functioning and better lung ventilation. So this is what the breathing techniques are aimed at.
Okay. Should everyone incorporate these, or in the daily lives, or there are certain group of people who really need to do it, like people who are affected by COVID, or there are certain illnesses that they have, like a pre-existing disease or a chronic ailment?
Yeah. So ideally, breathing exercises are really good because they not only help the lung function, but they also help overall body. Means by doing these breathing exercises regularly, we have noticed that patients tend to have low normal blood pressure values. Their heart functioning tends to improve. Also, they have lower stress levels. It helps you calm down. It improves your immune response, and it reduces your anxiety attacks. Okay, so along with improved lung functioning, we have noticed a lot of systemic changes. So if everyone does it, that is also beneficial for them. But in case if I mean, but those people who definitely require are those who have pre-existing lung illnesses, like I said, asthma or COPD, fibrosis, post-tuberculosis, post-COVID, or even during COVID. They should definitely do these breathing exercises for better and faster recovery.
That's great. And how often should one do these exercises? It should be a part of daily routine, or when you're feeling a certain way during the day or time?
So when it comes to breathing exercises that are taught to patients, there is a particular way of us managing them. Okay, so whenever there are patients with pre-existing illness, we normally incorporate them into a pulmonary rehabilitation program. Now, when I say pulmonary rehabilitation, it means it is a whole process wherein we are step by step getting the patients to become normal, like how they were earlier. Okay, and pulmonary means lung. Rehabilitation means the process of getting them back to normal. So that is how we rehabilitate their lung status so that they can be as active as they were before their illness. Okay, so breathing exercises are an important part of this pulmonary rehabilitation program. So every patient who is incorporated is assessed, and accordingly we find out what are the weaker points, and accordingly they are advised to do the exercises. So exercises right now, whatever exercises I'm teaching can be generally taught to everyone, but most of the time they vary from patient to patient in terms of it may vary even in terms of their age or whatever comorbidities, or if they are having any adjoining illness like diabetes or hypertension. So a lot of factors are taken into consideration, and accordingly it is decided how often they should be doing breathing exercises.
Okay. So doctor, everybody today, like I said, oxygenation is something which is a cause of concern. We all want to know how do we improve our oxygen levels. Are there any exercises that uh, all of us could do on a regular basis to improve our breathing?
Yeah. So these breathing exercises, especially the ones that help stimulate or strengthen your diaphragm muscles, should definitely be carried out because they tend to help with oxygenation. Okay. Now, those patients who have been diagnosed as having COVID, they are also advised to do these exercises. Just that we need to be careful that they do not overdo these exercises. So these breathing exercises, along with prone positioning, they tend to help your improve your oxygen levels. Okay, so all those patients who have been diagnosed as COVID or are in the process of recovering from COVID can practice these breathing exercises along with prone positioning. But again, the timing, the duration of prone positioning, or how much the prone positioning is going to help you will vary from person to person. Those people who definitely have drop in their levels of oxygen should go for a more definite treatment, that is oxygen supplementation. What these exercises or prone position will help is by time. Okay, will improve the window period so that you can avail a more definite treatment.
Okay. Would you demonstrate some of these techniques for us so our viewers can also understand what is it that they could do to improve the oxygen level?
Okay, so as I told you, there are a few exercises that everyone should be doing it. So I would demonstrate three such breathing exercises. The first is the pursed lip breathing. Second is the diaphragm breathing or belly breathing. And the third is the lateral costal breathing, which is a part of belly breathing. Okay. So these are the three exercises that help improve the movement of your lungs. Okay. That aim at ventilation, and they also help you reduce the number of times you breathe in a minute. Okay. So for example, you and I, we breathe around 12 times in a minute, right? But when a person is ill, the number of times the breathing rate tends to increase. Now, which is why the ventilation process gets shortened. That is, ventilation process means the time to breathe in, oxygen exchange, and the waste getting out of the expelled out of the body. When the time duration gets shorter, effectiveness reduces. So these exercises will help you breathe deep into the lungs, improve the timing for inspiration, opening of the lungs, oxygen exchange, and expelling the carbon dioxide. Okay, and strengthen the most important muscle, that is the diaphragm muscle. Okay, so the first exercise that I will be demonstrating is called the pursed lip breathing. First and foremost, what you need to do is, it's ideal that you sit on a chair while doing these exercises. So, and it is necessary that you sit in a comfortable and a relaxed position. So, sit with a good back support. Your shoulder, your neck, your upper chest should be relaxed. Okay. While practicing these exercises, it is necessary that we understand breathing exercise is not supposed to be exerting in nature. These exercises help you improve your oxygen levels and energy levels. So we need to reduce any extra expenditure of energy by reducing the number of by making it as simple and relaxed as possible. Okay. So the first exercise is pursed lip breathing, sitting in a comfortable position. You have to slowly breathe in from your nose and slowly breathe out from your mouth. Okay, but you have to purse your lips while you are exhaling from your mouth. Okay, so you slowly breathe in, feel your chest and your abdomen rising when you are breathing, purse your lips when you're breathing out from your mouth. Okay, so right, in this exercise what we can do is, you can breathe in for 2 seconds and breathe out for 4 seconds, right? So you can count 2 in your head while breathing in and 4 in your head while breathing out. And ensure that you're not straining your neck muscles. That's the wrong way of doing it. Okay, so breathe in slowly in a relaxed manner. Feel the air filling in the lungs. Slowly breathe out from your mouth, right? So that was the first exercise. Coming to the second exercise, which is called the belly breathing. For this, what you need to do is you need to place your hand over your belly. Okay? So you place your hand over the belly. You again breathe in from your nose and breathe out from your mouth. But when you're breathing in, you should feel your belly rising, right? So when you breathe in, okay, I'll change my angle a little bit so you are able to appreciate what I'm doing. Sit in a comfortable position, place your hand over the belly, breathe in, feel your belly rising. That is belly breathing. And the third exercise is called the lateral costal breathing, which is a part of belly breathing. So what you do is you place your hand at the lowermost rib of yours. So you can just feel your ribs, and where they end, just above that, you place your hands. Slowly breathe in. You can feel the ribs beneath your hand moving out. And relaxing when you're breathing out. One thing that you have to be careful while doing this exercise is you do not elevate your shoulders, right? So when you breathe in, sorry?
In a completely relaxed position.
In a completely relaxed position, okay? So the funda is prolong your breathing in and equally prolong your exhalation. आप जितना लंबा सांस लेंगे और स्लोली लेंगे उतनी आपकी सांस अंदर तक पहुंचेगी, उतनी आपको ऑक्सीजन exchange होगा and it will mix with the blood, right? So these are a few techniques that patients with COVID especially or pre-existing lung illnesses should definitely do because it helps recovery and improve oxygen levels. Now, along with this, I had mentioned about the prone position, right? So again, there is a lot of confusion about how to go into a prone position. Okay, so I will just demonstrate the prone position. I'll be lying on the bed. You have to take 3 pillows. Okay, and just give me a second, please. Okay. So for the prone positioning, you need 3 pillows. Okay. You place your pelvis. Pelvis is the portion just below our navel. यहाँ पे जो आपकी नाभि है उसके नीचे का portion is your pelvis. Okay. तो एक पिलो आपके शोल्डर के नीचे, आपके कंधों के नीचे होगा. दूसरा will be just below your pelvis and the third will be below your shin bone. Right? So आपको ऐसे लेटना है. ओके, एंड जब आप ये पोजीशन में लेटते हो आपका पेट बिल्कुल भी नहीं दबता. ओके, सो यू कैन फील दैट योर एब्डोमेन इज रिलैक्स्ड एंड यू विल स्लोली ब्रीथ इन एंड आउट. रेस्ट योर हेड ऑन वन साइड, रिलैक्स बोथ योर आर्म्स. Right? So this was the prone position. Okay, and all these exercises put together help improve your oxygen levels.
These were simple and really easy to do exercises. I think I'm going to do this right away and benefit from it. Also, doctor, you could do it like multiple times during the day, or is it like morning or before sleeping? Like they say, there are particular times when you should be following a particular health routine.
So ideally, these exercises, because you're lying on the stomach, you're doing it, they should not be done around your meal times. Okay, so either you do it before your meal times, jab aapka you are empty stomach, then that becomes easy for you to do it, or you do it 1 hour after your meal time. So you can do it around 2 to 3 times in a day very comfortably, and you can repeat each exercise from around 7 to 10 times.
Okay.
And prone lying you can do for around 15 to 30 minutes each time of the day.
Okay, that's nice. And are there any side effects to these breathing exercises?
No, actually, the benefits are so much that the only side effect is if you're going to use your neck muscles and shoulder muscles, you may feel lightheaded or very exerted, which is not what the techniques are about. So if you're doing the techniques in the right manner, there are no side effects.
Okay, that's great. And doctor, how does one really know that the oxygen levels have gone down? Any signs that one must catch on? Or also, what is the right amount of oxygen in the body that you need?
Right. So I am sure everyone is aware about what a pulse oximeter is, right?
I think we're using it a lot now.
Yes. So just give me a second. I will get my pulse oximeter. I'll show it in front of you. Okay. So this is a pulse oximeter. and you place it on your index finger and it gives a reading. Okay, now this is something that people have been regularly monitoring, but if your levels go below 95 on the pulse oximeter, that's when you have to be worried. Okay, or if you do not have a pulse oximeter and if you feel that you don't have any ways of checking it, if you're feeling breathless, short of breath, that's when you can get your oxygen checked.
Okay. And what if you feeling a little breathless? Can you actually, at that point in time, do these exercises to feel better or like regain the oxygen levels in the body?
No. The times when you shouldn't do these exercises are when you are febrile. जब आपको बुखार है, जब आपको fever है, you should not practice these exercises क्योंकि तब what your body needs is adequate rest. Okay? अगर आपको कोविड डिटेक्ट हुआ है, आप पॉजिटिव है, आपको सिम्टम्स है, तो प्लीज डोंट अटेम्प्ट डूइंग दिस एक्सरसाइजेस. ओके, दिस होल्ड्स ट्रू फॉर एवरीवन. मतलब जो लोग इवन विद प्री एग्जिस्टिंग इलनेस, अगर उनको बहुत ज्यादा ब्रेथलेसनेस है, सांस लेने को डिफिकल्ट हो रही है, एंड दे आर शॉर्ट ऑफ ब्रेथ इवन व्हेन दे आर रेस्टिंग, they should not perform these exercises. Okay, the third thing is when you have a lot of cough. Okay, so much so that even eating and sleeping are getting disturbed because of cough, you should wait for first to get your cough checked, find out what is the problem. Once things are settled, once your cough has reduced by 50%, then you can do it. Okay, when you're feeling very weak, so much so that even turning in the bed is difficult, you shouldn't practice these exercises. Okay, so now if you're feeling out of breath or severely breathless, ओके, तो जैसे एस्थमेटिक पेशेंट्स में होता है, कभी कभी जब भी उनको एपिसोड्स आते हैं, व्हेन दे दैट इज द टाइम दैट only the medication inhaler tends to help them.
Yeah.
What we teach them are a few breathlessness relieving positions. Okay, so उन पेशेंट्स को हम क्या बोलते हैं कि you have to adapt to certain positions जिससे आपका breathlessness थोड़ा रिलैक्स हो जाएगा. Okay, so you don't perform breathing exercises, but you tend to adapt to those breathlessness relieving positions. So I'll just demonstrate one position. Okay, so for example, if I'm short of breath and if I am breathing very fast, okay, तो हम what you can do is you can sit on a chair. Okay, you can spread your legs, lean forward and sit. Okay, so आपको आगे झुक के बैठना है. Relax your elbows over your thighs and slowly breathe out from your mouth. During these times, you don't have to think about prolonging your exhalation, prolonging your inhalation. You have to just try and catch your breath. Okay, so go with the flow. When you are sitting in this position, trying to breathe out from your mouth, automatically आपका breathing rate थोड़ा relax हो जाएगा. Okay, so when your breathing rate becomes relaxed, when you're able to breathe a little better, that's when you will be in a better position. So what happens is during such episodes, there is a panic like situation. जब breathless होते हैं तो you all feel panic. तो panic की वजह से breathlessness increase हो जाता है, right? So when you are in this position, at least anxiety and the panic that is arising because of the situation gets relaxed. Okay, and by that time maybe you can arrange for a more definite treatment, and that's how you can take it forward.
Great. And what are the long-term benefits of these exercises?
So improvement of your lung function, increasing your lung capacity, improved concentration levels, improved energy levels, improved immune responses. They are all also improved responses of your heart towards exercise. यानी आपका blood pressure का जो fluctuations है वो सारे भी relax हो जाते हैं. So these are all long-term benefits of breathing exercises.
Okay. Do these help if you do it before your everyday health routine?
Yes, definitely. You can first
a little more, or is it like the same benefit but
you will be able to exercise better. Now, for example, if you're going for a walk, okay, and if you're doing breathing exercises before going for a walk, you will definitely notice an improved speed and improved stamina.
That's great. Those are interesting benefits, in fact. And how often can you do these exercises in a day?
Yeah, so as I mentioned, again, the frequency of the exercise varies from individual to individual depending on the condition. But you can practice, if it is a normal, healthy individual, you can practice around seven to each exercise 7 to 10 times, once or twice in a day. Patients with pre-existing condition, they may have to practice more than 2 times in a day.
Okay. And this is common regardless of the age. Everybody
Yeah.
can do it from a child.
Yes, it's very safe. For a child below 10 years of age, it gets difficult to teach. So maybe once the child is,
But they seem
huh?
very easy to look at.
Yeah, they are easy, but a child below 10 years of age, I don't think they have the patience and the they cannot sit in one place, and it is not right for us to do it unless it is essentially required. So there are more playful techniques that we have for kids below 10 years of age, wherein we bring about the same benefits, same effects, but in a more playful manner.
Can you help us with one or two tricks for kids so parents who are watching, our viewers, can also benefit from it?
So there is something called as the bubbling activity.
Mhm.
तो आप bubbles करवा सकते हैं. Kids can so you can just take a glass of soap water, take a straw, and ask to blow into it. Blow into it is more important. They shouldn't suck it. Okay, so blowing will create bubbles, right? So bubbles is a feedback. Barabar? So another thing that they can do is they can blow balloons. So you can get those large balloons with party balloons, which are very thin. Means they are not very difficult to blow. They can blow balloons, or they can even the soap water bubbles. जो आते हैं, they can make bubbles in the air. Right. So they are again some playful techniques.
Also, doctor, are there any tools that one could use for these exercises?
Yes, there is. I'm not sure if, but a spirometer, incentive spirometer is something that a lot of doctors advise patients with lung problems to get. So, incentive spirometer is something like this. Okay, it's a small device, and these mean the volume of the air. मतलब आप कितना air अंदर breathe in करते हो. Okay, and this is the pipe, and this is the mouthpiece. So when you're using this, what you have to do is, again, you have to sit in a relaxed, comfortable position. You have to put the mouthpiece in your mouth, seal it with your lips, and you have to slowly breathe in. Okay. So while I'm breathing, you will notice there are two pistons. There is one small yellow piston and there is one large piston. Okay. Now, there is a blue color box. The small piston has to be held in this blue color box. While you're holding it, the larger piston will ride up. Okay. I will demonstrate. I think that will make it easier to understand. Okay, so as you are noticing, there are two pistons. The smaller one should be held in the blue box so that we ensure that whatever we are breathing into the chest and the abdomen, and the neck muscles and the shoulder muscles are not getting activated. Okay. So if I'm not holding the piston properly, that's the wrong way of doing it. Okay. So again, sit in a comfortable position. And slowly prolong your breath so that you can take larger volumes of air, but without adding more musculature into your, without exerting yourself.
Yeah.
Okay.
Very interesting. And all of these tools are available easily in the market today?
Yes, definitely. A spirometer, they come in various forms. There is a single ball spirometer. There are 3-ball spirometer. But the most recommended for post-COVID patients are such spirometers. These are called volume-based spirometers. Okay, and a lot of companies are manufacturing these type of spirometers. So you can just Google incentive spirometer, and there are a lot of options available online as well as offline.
That's amazing. That's interesting, in fact. And can kids also use it?
Yes, there are fancy spirometers of such kind available, wherein there are smileys. So kids don't really follow the numbers very well. So the smileys will direct them as to how much volume of air they need to breathe in.
That's very interesting. I'm sure all our viewers, especially who are parents, would love these techniques.
But one thing I'd like to add,
Yeah.
please, before making your child do any of these activities, consult your pediatrician. Okay, it is, some kids definitely require it, but sometimes out of worry, parents tend to make their kids do all of this. So don't do that. Please get your kid checked first, and only if required, please make them do these exercises.
Great. That's amazing, Dr. Amee. I would like to really thank you for the wonderful session and teaching us all these interesting exercises that could be part of our daily routines. And to all our viewers, do practice these breathing techniques, and I'm sure these will benefit you in current times. Thank you so much for joining Health from Home.